How could Medicaid cuts impact you right here in Oklahoma? Dozens of hospitals across our state were operating in negative margins and were at risk of closing before the big, beautiful bill.
KOCO got the facts on just how these new cuts could impact communities across Oklahoma.
Cuts of this magnitude, we have not seen anything like this in our recent history.
The big, beautiful bill that passed the House Thursday includes drastic cuts to Medicaid. The goal, to eliminate fraud and abuse within the program. But hospital leaders say it will do more than that. Last week, administrators across Oklahoma called for action, asking lawmakers to find another way to reduce spending without cutting Medicaid.
We urge our senators to really listen to what this would do to the state. It is enormous, and there's not a plan for what would happen to fellow Oklahomans.
The spending bill includes nearly $1 trillion in cuts to Medicaid. Last year, a report showed there were 47 rural hospitals at risk of closure. 23 were facing immediate closure, even before the bill was in the works.
At a maximum, I think it hastens the speed that rural hospitals predominantly would be under pressure of potentially closing.
Oklahoma has already seen 10 hospitals close since 2005, and these facilities are often the largest employers in communities. These cuts could lead to more than 14,000 jobs being cut.
What that's going to do is that's going to cause families to relocate to areas with more accessible health care, and economies in rural communities are going to decline because of that.
Hospital leaders even broke down how much funding would be taken from hospitals in each Oklahoma congressional district per year. The Oklahoma Hospital Association says it would take $8.7 billion away from Oklahoma's economy over the next 10 years. But it's not just about job losses. Hospitals across the state could be forced to cut programs, including labor and delivery services. There are currently only 43 hospitals in the state that provide these. Hospital administrators say 54% of those rely on Medicaid.
If Medicaid gets cut this drastically, you're going to see fewer hospitals that deliver babies for all patients. And that's just very simple math.
And these problems won't just impact those rural hospitals already at risk.
As access to health care for all Oklahomans will be affected.
The pressure on the system that this will create beyond just what happens here is enormous. We're all interconnected. We'll often get into these conversations of rural and urban, but there's not much of a rural and urban in healthcare anymore because we're all in this together.
Senator James Lankford joined KOCO after the House vote, saying Oklahomans should not be concerned.
We added a $50 billion fund for rural hospitals to make sure there wasn't an impact on rural hospitals and they're protected, because that's very important. I've worked a lot on the rural hospital issues for years. It's very important.
The bill appropriates $10 billion each fiscal year from 2026 to 2030. States that are eligible must apply for the funds by the end of this year.